I have a handful of questions. We have some questions coming in from our viewers out there, so we'll get to some of those also. But I think an obvious question that a lot of folks have is what's been the impact of COVID? And Dr. Dreyer, I was hoping you could maybe talk about that and tell us in your own clinical practice, what are you seeing already because of COVID, and how much of an effect has it had on economic status, as well as stress, health, and education, and other factors?
Yes. So COVID has dramatically negatively impacted if you think about the Venn diagram of poverty versus racial ethnic inequalities, I think that especially where both of those come together, there's been a huge impact of COVID. Most of the frontline workers who have been at most risk of getting COVID have been African American or Latinx. In addition, they are the low income wage earners, which were the first to be furloughed. So suddenly these families had no income. They went from minimal income to no income. And as I showed on one of my slides, their assets are close to zero. So they don't have a cushion to protect them in lean times, as opposed to other groups who have a big cushion. So many of my patients, I only take care of poor patients, but most of my patients are Latinx or African American. And we were calling our patients to see how they were doing, and mothers would say on the phone, or if they actually came in person, I have zero money. I don't have enough money to buy food for today. I don't have enough money to pay rent next month. And many of these people, although some people got benefits from the government through these trillion-dollar bills, most of the low-level people did not qualify for that, either because they were, they had no benefits from their company, or they were working off the books, or whatever the issues were for them. So they went from minimal poverty, minimal assets to zero assets. And we actually at Bellevue, our doctors began raising money so we could hand out $100 gift cards for people to just buy foods or pay for other necessities. So a huge impact on poor kids, but I would say mostly Latinx and African American kids, because they are the group of kids that have usually, as I showed on this slide, almost no assets to cushion them in hard times. They were also at greatest risk for getting COVID. So many of my patients, their older elderly parents died. I mean, New York had a large epidemic and many deaths, and most of the younger family members did not die, but many of their grandparents, uncles and aunts and other extended family members died during the pandemic. And I think this is true across the country.
Okay. And Joan Alker, if you talked a bit about what the data through 2019 showed, and you touched on what might be coming after with the COVID numbers. Do you have any kind of preliminary sense of what the effect of COVID on children's coverage has been, and when will we know for certain?
Yeah, so unfortunately, we really won't know for a while for certain, they're mitigating reasons on both sides. I think almost certainly the number is going up of uninsured children. The question is by how much. And of course, we've seen tens of millions of people apply for unemployment. But how many of those people had employer-sponsored insurance and how many of them lost it, we don't precisely know. I would say the best study that I've seen this summer came from the Urban Institute, and they projected that 2.9 million adults and children would become uninsured as a consequence of the pandemic. We don't know how many of those are children. Now, many of these children are going to be eligible for public coverage, Medicaid or CHIP. The question is, do they know that? We haven't had any national effort to inform families about the fact that they or their children might be eligible. Folks have had a lot of difficulties applying for unemployment benefits, as we all know. So that may be discouraging to these families. On the plus side, we do have as a consequence of the Families First legislation right now, we have a disenrollment freeze in Medicaid. So states cannot terminate any kids involuntarily. And that's good news with respect to those red tape problems I was mentioning. However, on the flip side of that, we still have the chilling effect I mentioned. That's not changed. There's no disenrollment freeze on the CHIP program. And we have, potentially millions of folks who have lost their access to employer-sponsored coverage and may not realize, may not have help in their community to help them understand what their options are for their kids. So I think we'll see the number go up. By how much, we just don't know. Okay.
Quick question on definitions. When you're talking, your numbers that talk about the number of children who don't have health coverage, or the number of children who do, is that, if somebody is counted as having health coverage, does that mean they're actually enrolled and actively using the health system, or do the numbers just indicate that they're eligible?
That's actually that they answered the survey question saying that they did have health insurance.
Okay. And is there any sense about whether there's children and their families that do have health insurance? Are they taking advantage of it? Are they getting the checkups that they need? Are they getting the vaccinations that they need? Is there a difference in income levels on that measure?
Yeah, I'm sure Dr. Dreyer is going to comment on
that. I would make two comments about that. First of all, just to reiterate Joan's comment about the chilling effect on immigrants. Many immigrants are afraid to access benefits for their citizen children, which is really not part of the public charge. But what we refer to as the chilling effect is just the fear that's rampant in the immigrant community. So I have many families who've stopped getting food stamps for their children, or WIC, Women, Infant and Children Nutrition Program, which is, again, not part of the public charge, but because they're afraid to go for any benefits. So we have seen an impact on that. We've also, of course, due to people in lockdown, had some delays in immunizations. I would just say that at least in New York City, we've made a major effort to catch up, and I think we're doing a really good job of pretty much catching up on vaccinations for all the kids who didn't come in during the worst of the pandemic.
Okay.
So I'll just quickly add two things on that. Some of the quality measures that I mentioned, you can go see how your kids are doing with respect to things like access to well child visits, access to well baby visits, vaccination rates, and there are differences there. Generally speaking, in the big picture, kids on Medicaid are accessing primary and preventive care at similar rates to kids in private insurance, which is good news. However, as we know, utilization has dropped during the pandemic. And a study this summer by the Commonwealth Fund found that while a lot of specialties were bouncing back, pediatrics remained 25% lower than the baseline. So for some reason, in a national study anyway, it's bouncing back more slowly. So that's a real concern.
Question from Sandra Jurek, a freelance journalist. Do we have a number for the loss in terms of GDP per child, separate from the cost of healthcare, social programs? She said she's looking to reframe what taxpayers lose by paying attention, what taxpayers lose by not paying to alleviate poverty. I guess, Dr. Dreyer, some, the big numbers that you have looked at, is there
So
a way to
there's
frame
some
it in terms
good
of
macro, I'm sorry. There's some good macro and economic studies looking at the impact on the GDP, which is somewhere between 4 and 5% annually decrease of the GDP because we don't impact child poverty. That is based on long-term effects of child poverty. So as children suffer health issues as children and don't graduate from high school and make less money as adults and are more likely to be in the criminal justice system, those costs to society that I mentioned of 800 billion to 1.1 trillion equal to 4 to 5% of our GDP. And there are good studies that look at that.
Okay. So a question from Kativa Shankar. Among the programs that you evaluated, this is for Dr. Dreyer, I noticed an evaluation on child nutrition programs. I understand this is a not cash in hand or voucher, but a free reduced meals increase of disposable income. I mean, how much of the programs, how much is actual money being paid out versus like a reduction in cost? Is that something you can assess?
So I'm not quite sure what the question means, but I'll tell you what I know.
Okay.
So for food stamps, there isn't a reduction in price. There is simply money, an electronic card given to parents that is a supplement. It doesn't cover all their food needs. There are studies that look at most of those families run out of food stamps about halfway through the month. But that's straight supplement of cash to buy food that can be used in food stores. I think where there's either reduced or no cost are school lunches and breakfasts, which has been, I didn't mention this, but this was a major nutritional impact during the pandemic because poor children often get 60% of their calories every day through school breakfasts and lunches, and suddenly they were not in school. Some places like New York tried to deliver food to those families, but this is a big source of calories and nutrition for kids. Most poor kids don't pay anything, but some of them have reduced lunch fees as far as school lunches and breakfast. WIC is not reduced either. It's actually giving food to pregnant women and young children.
Okay, kind of a related question. Since school is closed, should food stamp allowances be expanded?
Yes. There was some increase actually in food stamp allowances during the early part of the pandemic. They should be increased further, and we have been advocating. I know in the Democratic bill that's lying fallow somewhere in Congress, there's a discussion of increasing food stamp allotments even further. Okay.
So I have a question. I'm going to put it to both of you, but I guess we'll start with Dr. Dreyer. In the roadmap, you have a list of policy changes that would help alleviate poverty and help boost children's health. If you had supreme control over the levers of government, which one of those things would you like to do? Which is the one most important one?
Well, if I had control of the levers of government, there are a variety of things I would probably do first, even before these.
Right.
But nevertheless, to answer your question seriously, it would be the child allowance. So there was actually a bill in Congress from 2019. It was actually put in the latest Democratic COVID bill as well. It's called the American Family Act, or there's another name for it as well. But basically, this takes the present child tax credit, which does not benefit much the very poor, and makes it completely refundable, meaning that you get it even if you don't make any money. And it also increases it to $3,000 to $3,500 a year with younger children getting more, and also pays it monthly so that families can actually integrate the money into their regular budget to help their kids, as opposed to getting this X amount at the end of the year. So the American Family Act, you can look it up on the web, which is basically our child allowance recommendation. That would probably reduce child poverty between 40 and 45% by itself. There are many other things that poor families need. I don't want to put down increasing the earned income tax credit for those who are working. Also, making it more refundable. It is refundable, and also helping families get a living wage by increasing the minimum wage much higher than it is now.
Okay, so Joan Alker, your same question to you. We've now given supreme control of the government levers to you. What's the one thing of the various policy prescriptions that you would be most interested in seeing?
Well, I think income is probably the critical issue at the end of the day. That's a little outside my purview, but that's what my gut tells me. I'll tell you from a kid's health insurance perspective, although it almost feels too slow given the crisis we're in, but an idea we've been batting around is that no newborn should leave the hospital without coverage, and this should be a societal expectation. The parent can put them on their employer plan, or they're just automatically enrolled in Medicaid, and then they stay on till they're 5, no questions asked.
Right.
And then when they get to school, we'll check in on the situation.
Okay. So question from Carolyn Montoya of the University of New Mexico. New Mexico has one of the highest poverty rates in the country. We do have Medicaid expansion, and I'm concerned that the federal government will go to block grants. What are your thoughts about if that happens?
I can respond.
You should respond.
Yeah. So this has been a sort of perennial fight, and in the 27 attempt to repeal the Affordable Care Act, the congressional bill did also block grant or cap the Medicaid program, ending its current entitlement status just while they're in the neighborhood. That actually has nothing to do with the Affordable Care Act. We've had that financing structure in place for over 50 years. So I think if we see current, the Trump administration, if President Trump wins re-election, if the Republicans maintain control of the Senate, it's absolutely possible that we will see efforts again to block grant and cut Medicaid. Medicaid is the largest program that the federal government has that serves poor people. And that's why I think it will always be the target of cuts.
Right.
And in the crosshairs. If we were to see, there's also attempts by the Trump administration to allow a few states to cap or block grant their Medicaid program through what's called Medicaid waivers. And currently Tennessee has such a proposal pending, and Oklahoma did, but that's sort of hopefully gone by the wayside. So there's absolutely interest in that, but again, it all depends on the elections.
Okay. All right, so question from Kathiva Shankar. If we know we need to be at least at the 200% of poverty level, why do school nutrition programs for free and reduced meals have the at or below 130% as eligibility criteria? What's the basis for the 130?
There is no basis because, they started out below 100 and they've worked their way up to 133%. And remember that Medicaid level was worked its way up, I think, for children to 133% as well. So as far as I'm concerned, there is no basis for that. We should be really going up at least 200. And actually, Child Health Plus in almost all states goes up to 200% of the federal poverty level, and many states go above it. We would encourage states to go above it as well to supplement for those kids who are not getting Medicaid. As far as food stamps, I mean, that's a problem which there is one solution to, and that is a community designation. So what that means is a school can go for a community designation, which means that if a large percent of their kids are poor, they can offer free lunches and free breakfasts to everybody in the school without getting people to fill out the paperwork and feel stigmatized by the process. So I think we would, our goal would be to extend a community designation to all schools and give all kids free lunch and free breakfast, and then we don't have to worry about 60% of their calories.
Okay, so let me see. I have a comment from Allison Bowman. Want to recommend the book called Administrative Burden, Policymaking by Other Means by Pam Hurd and Don Moynihan, also from Georgetown, for more about the red tape that Joan mentioned. So just a tip for a resource for you all. The policies in the book introduce burdens in the form of information costs, compliance costs, and psychological costs for families. So that's just some resources for you. We just have time for one or two more questions. I do have one for Dr. Dreyer. Can you talk a little bit more about the connection between ACEs and stress? And is this stress on the children or stress on the parents? And how does it change children physiologically?
Yes, so I think that's coming up. We should put in a plug for next week's talk, because
Okay.
Jack Shankoff is the master of that, but let me briefly address it this week. So I took all those slides out because I knew Jack was doing it next week, but basically we know that ACEs, adverse childhood events, cause chronic stress on the child. And while a little stress is maybe even good for any of us, chronic severe stress, when it's not being ameliorated by an adult protecting you, which is the situation that most kids with ACEs are in, causes significant increases in their cortisol level, causes epigenetic changes. These are changes not in your DNA, but in how the DNA works to make different enzymes. It turns off good enzymes and it turns on, bad genes. And so between epigenetic changes and changes in the structure and function of your brain, children become more responsive to emotional problems and less able to use the parts of the brain that cause them to regulate themselves and to pay attention and to use their memory for learning. So that's the way stress gets into your body, and there's some evidence that it may even make enough changes to go into the second generation.